Well, aloha, good Monday morning to many of you. We know that you are taking the day off, but we do appreciate you being with us here on Spotlight Hawaii. I'm Yunji Denise, joined by Ryan Kalei-Suji. And Ryan, today we have a guest that always answers lots of questions and certainly gets a lot of them as well.
Yeah, somebody who we seem to have on anytime there is a holiday, so we appreciate him joining us. Lieutenant Governor Josh Green joining us here this morning. Good morning. Thank you so much for being with us and taking this time to take some of the questions that are going to be coming in from our viewers.
Thank you. Yeah, we need some independence on this Independence Day weekend from COVID, so I think it's a good time to talk.
Let's begin with where we're at with the vaccination process. We know that the state continues to march forward towards that 60% and the ultimate goal of the governor's benchmark of 70%. Where are we at right now with the vaccinations?
So we're at 58.3% of the state is vaccinated fully, and 62.7% of the state has received at least one shot. Let me break that out a little bit more because we're getting to some major milestones. So we are just a small number of people away to get to 60%. So we are going to open up on July 8th to allow people to use their vaccine cards to travel to Hawaii. We will get this it's 61,600 people completed for their vaccines. That will take us over 60% to 62.7%. And then we'll have the final push. But if we want to get all the way to 70%, it's over 250,000 shots still to go. And at the rate that we've been doing them, about 3,000 shots a day, that could still take over 2 months, almost 3 months. So we've made great progress. We're better than, I think, every state, but maybe 3 other states. I want to say Vermont, District of Columbia, and maybe Connecticut. But the governor has put a pretty high bar out there, especially since we're not counting those children under age 12 who cannot be vaccinated. We've made great strides. We're doing well, but there's still some COVID out there. And the last thing I would say, Ryan and Yunji, is though we have 58.3% completed and 62.7% at least started, that leaves about a third of our state that has not sought vaccination yet because they're too young or they just chosen not to. It's about 450,000 people that have no immunity. 250,000 or so adults are out there who have chosen not to be vaccinated. And with the Delta strain that's in our midst, they're very likely to catch COVID if they're not careful. So I would just, out of love and respect to everyone, say, please get vaccinated, because we saw 7 individuals yesterday get admitted to the hospital at Queens. And it's not completely over yet. So those individuals were not vaccinated. I'm sure they caught the Delta strain. I'm almost certain. And it's going to be a heartache if we still have some COVID here a month or 2 months from now.
You know, the last time you were on, we talked about that reaching that 70% and what it would take. And you said it was actually 82% of those who were eligible, and that perhaps there were conversations about considering other metrics when it comes to lifting some of these restrictions. Is that something you're still, are those conversations still ongoing? And what other metrics would you advocate looking at if we can't get to that 70% in a reasonable amount of time?
Yeah, those conversations are absolutely happening. And the governor is committed to looking at other metrics like our case rate and our hospitalization rate. The Department of Health is more conservative also, and they really like the idea of reaching 70%. But on the flip side of that, I had a good conversation with Mayor Blangiardi earlier today, and he and I were of the same mind that you have to be real. I mean, people have to take some responsibility. Everyone's had many months now to get vaccinated. So individuals who choose not to be vaccinated, they may have made up their minds. We still are getting a few thousand people a day, which is great. But we also have to be thoughtful because a lot of others are having to suspend their lives and not return to normalcy because about 250,000 adults have chosen not yet to be vaccinated. I think that what will happen ultimately, if I had a crystal ball, I think we will rapidly get to the 65%, which is a more reasonable threshold of those who are eligible. I think we should strongly consider counting an additional 5% of people who had COVID or developed natural immunity. And at that point, stop tilting at windmills and open up safely, still be mindful when we have hospitalizations, but don't condemn the state to staying closed or restaurants not being able to operate for many months because a few people decide not to be vaccinated.
And so if there is any adjustment made to that benchmark of 70%, say with some of the recommendations that you just laid out, what would that look like moving forward if the governor does say yes, or we do get to that 70%? Does all restrictions go out the window, or is there still going to be mask wearing in certain venues, these large gatherings? We know that football season is around the corner, and other athletics with high school football competitions and large gatherings. Are those going to just operate as as they used to be, or will there be some restrictions still recommended that are put in place?
Well, that is the $64,000 question. Here's what I think will happen. As we get closer to August 8th, 8/8/21, that's when the emergency proclamation is going to expire. I think people's appetite to have emergency rules has waned, and I think it's time to move on from that. So the governor has told us that we're going to end the emergency proclamation around the 8th of August. I think that is the date at which some of those decisions will be finalized. So from July 8th until August 8th, I would expect us to aspirationally continue to vaccinate as many people as we can and get our case counts down as low as we can. But that will empower the governor to remove most of the final restrictions. He may decide with the Department of Health to still have some recommendations for large gatherings and mask wearing. But I have a feeling, I have a sense that many of our restrictions, if not all of them, will go away at that time. I think we will realize when we look at how many people get vaccinated in the next 34 days, we'll realize that it will reflect a full slowdown because there just aren't that many people left that are willing to be vaccinated. We're doing all that we can, going into people's communities, almost going door to door, going into very small communities across the state. But sometimes only 15 or 20 people are coming out of the woodwork to be vaccinated. And sooner or later, we will have to be realists. The fact that we're better than 46 other states is something to be proud of. They have much greater problems. There are some states out there that only 35% of their people are vaccinated. They are going to get crushed by the Delta variant. We, however, have a very good situation. We've got a cohort of travelers that know that they have to come here with some aloha and be vaccinated or tested. We know that our businesses are, still encouraging people to wear masks indoors. So people have been very responsible. That's why our numbers have not spiked in a long time. We're at 45 cases per day on average for the last week. Today it was 48 cases. 40 people are in the hospital. But we've kind of reached a dynamic equilibrium. It's very flat now. Almost the same number of cases day over day, almost the same number of hospitalizations. So we may very well be living with these kind of numbers. And that means we got to begin to return to normal. Football will come and people's graduations will come again and weddings will return. Birthday parties will be necessary. I think it's going to be time to get back to normal around August 8th. And then the only other milestone I know of that's shortly thereafter is Labor Day, kind of the end of the summer.
You mentioned the changes to safe travels that are coming up. One of the things that there has been some concern about is the fact that tourists can come in with vaccine verification, but there's no way for the state to verify that those vaccine cards are authentic. Are you concerned about that at all, that there will be people who are essentially faking being vaccinated and come into the state anyway?
Well, I don't like it if somebody considers doing that, but I'm not concerned about it. It's very few and far between. To go to that length, to travel to Hawaii for vacation and expose oneself to a federal crime, which is falsifying a federal document, it's really rare. Remember also the prevalence of the disease, the virus itself, has become utterly low. There were only 3,697 cases across the United States yesterday that were verified. Though it was a holiday weekend, there was a little less testing. The case count average has been around 10,000 cases out of 330 million people. So think of it in these terms. Very low likelihood that someone's got COVID that would travel. Then the likelihood is they've been vaccinated anyway. So you end up chopping these numbers down to minuscule risk. Still, I don't like people faking the rules. What I do worry about is we've turned a lot of people away who were fully vaccinated. They came too soon and they got the wrong test. I've heard many horror stories about this, and it kind of is gut-wrenching. We're sticking close to the rules because we've wanted to be the best state in the country, but there have been many people that have fallen into this kind of gray area and have been sent on their way, even though they were vaccinated. Now, that's going to be solved more or less on July 8th. It's why I advocated for July 1st. I don't want to relitigate that with you guys. I felt strongly because I wanted to simplify things over July 4th weekend, but they've been pretty calm at the airport. Ford Fujigami, who's terrific, told me that things were going very smoothly across the state for the most part. But now that will not be a big issue. The bigger issue is going to be in areas where we have rural populations that didn't get as many vaccinations done. Places like Ka'u, Waianae, where a smaller percentage of people chose to be vaccinated. That always happens in our rural communities. That means that if there are outbreaks, those outbreaks will probably occur there, where they're like 45% vaccinated instead of 58%. And it could pop at some schools where kids, even though they'll be wearing masks in schools if they're under age 12, you can be sure of that when school reopens. You just could imagine some outbreaks because individuals have not had the opportunity to become immune. And it won't be from tourism. It will just be because we have a pocket of people that did not choose, and I respect their autonomy, but who did not choose to be vaccinated.
Let's expand a little more on tourism. We know that there continues to be a growing contention between local residents who live here, who've enjoyed the fact that they could go to the beach and hang out in Waikiki during COVID. Now, not so much. I mean, we look at the beaches here. There are a lot of tourists that are visiting our islands. There was a protest that were held throughout the state at airports just yesterday with many who are protesting the arrival of these flood of tourists that we're seeing. Are you at all concerned of this growing contention between residents and visitors?
I absolutely am. This is a clear reflection of where people are. First Amendment rights, freedom of speech, freedom of protest. I am a full supporter. However, it makes me feel sad that we end up at an impasse with our own friends and families. Let me break this down. We have to have some tourism, obviously, because we have to pay our bills. We have to pay for food for our keiki. We have to pay for school and school books and hospitals and so on, right? So we have to have our economy. But sometimes enough is enough. And so my team is looking very closely at exactly what the carrying capacity should be for the state of Hawaii. Lots of good work has been done on this by HDA and others, but I'm going to look into it, and I've begun to look into it very, deeply. It's much more likely that we can tolerate 7 or 8 million tourists rather than 10 or 12 million. And that was the case before. It's just now we have a lot of individuals that come on very bargain rate trips, and they completely occupy the state. A couple other things, though, that people should be careful. Let me just, as a friend, remind people, if you're going to protest, especially in like caravans or whatever, be mindful that you may have to move over quickly if an ambulance comes by. I don't want anyone, and we have this happening from time to time, that an ambulance can't get by if we block roads. We don't want one of our loved ones to die from a heart attack if they, couldn't get past the caravan. So please be thoughtful about that. Of course, people have a right to freedom of expression. The other thing about tourism is you can't just really turn the spigot off unilaterally by saying, don't come. Total respect to all of our mayors, including Maui's mayor, who I really adore. But, it's difficult because you have the carrying capacity of the airlines and the hotels, and people have planned for months how many people will come. What I would prefer to see is, as we reach kind of saturation with tourism, that we apply extra fees or impact fees because we need to reinvest money in our own state. And that will discourage over tourism. There's going to be that kind of thing that has to happen. I doubt very much we're going to see objective caps on it. It would be much better to earn our money through lower impact industries and begin to get control of illegal Airbnbs, get control of people just flying in at the last moment for $150. That's not good. So this is what we got to work on, but we're catching up from a year of essential economic starvation. We are at 5 million, I checked the number today, 5,003,435 total travelers, of which, keep in mind, a third of them were us returning to see our loved ones, reuniting our families. So we're about 3.7 or 3.8 million actual tourists for the period from October till now. We'll touch about 5 million tourists total for the year. That's about cut in half. So I just think it's freaking people out a little bit because it's all coming in the summertime.
I wonder from a practical standpoint what actually can be done, because as you said, it's not as simple as flipping a switch. You can't, we are still part of the United States, and it's not like we can say, no, you can't come here. So what are some practical mechanisms? You mentioned the Airbnbs. That's really at the county level in terms of enforcement. What can the state actually do? Are you engaging with the airlines? Because it's not in their interest to cut flights. How do you actually on a practical level do this, or do you put that fee that you're talking about in? How expensive do you need to make it to discourage the numbers that we're talking about?
Well, we know that the macroeconomics will manage the problem to a degree. I was talking to a very close friend who's one of our leaders in the state, and he paid $1,300 for a plane ticket for his daughter to return from New York, and another $400 of additional cost to make sure she had an extra good seat. So at $1,700, fewer people will travel here. I think that this is my early opinion, and I'll be discussing this with you over the coming months and years, I'm sure. But my early opinion is you continuously increase the quality of tourism, and with the quality, up goes the price. But people then hopefully stay longer and are willing to spend significantly more for a much more quality experience that's culturally appropriate. People will pay a lot to come to Hawaii, and they should pay a lot to come for an extraordinary experience. We don't want them paying very little for a crummy experience. And packing people in does not do anybody any good. So I think that actually being smart about this and increasing the quality of all of our facilities, most of which are terrific already, will actually drive the economics up. We will have fewer people overall with the same amount of revenue. That is one major approach. And then as to impact fees, the way you would do that would be, and this would have to come from statute without a doubt, but what you do is you look at last moment travel, and last moment travel should have a fee applied to it very likely, because when you have another 2 million people pile on at the very end, that's when you can't get into Honolulu now. You can't get into the particularly beautiful and sought after spots because anybody just rolls in. And so we do have some capacity to make that, I guess, a little bit more of a conscious effort. So smart tourism, and I know it sounds cliche, is on the table, but we have to get all the people in our industry on the same page, because a lot of people have invested in their infrastructure, billions and billions of dollars, and it's not fair just to spring something on everyone. This year, we're playing catch up, but in the out years, 2022, 23, 24, I would hope we have far fewer people spending more for a better experience.
And who would facilitate maybe those fees? Would that be a group like the Hawaii Tourism Authority? Because as we know it, where that entity stands right now, they're in jeopardy of losing funding. And the governor has tried to find ways to support the Hawaii Tourism Authority, and yet the legislature has passed a bill that would essentially change the dynamics and the structure of the Hawaii Tourism Authority. So with some of those recommendations you are suggesting, would that be something that the Hawaii Tourism Authority would have to oversee? And how would you maybe work with legislators and lawmakers in the legislature to justify the role of Hawaii Tourism Authority overall?
I personally would want the legislature to guide us on that. I think it's the role of the legislature, and we should respect their role to make those kind of decisions. And then the administration should do what our descriptor is, which is administer it properly, very transparently and deliberately. But I think that's the kind of decision I want to see coming out of legislators who I have a lot of respect for, whether it's Rep. Luke or Senator Dela Cruz, the Speaker, or the Senate President and their coalitions. They obviously have spoken loud and clear that they are not happy with everything that's gone on HTA. Now, I don't want to be in between the governor and the legislators in this particular battle. Needless to say, I would like to have kind of a more positive relationship with everyone. But I do think it's their decision to make. I'm just saying from a policy standpoint, it makes a lot of sense to have such a fee and that revenue to decrease the negative impact on our beautiful islands. So that's something they should decide. And I know that they don't want to hand a big hunk of money over to HTA right now if they're not on the same page. We ought to be able to get on the same page on this kind of thing, because I think it's becoming quite clear that nobody in the state wants to see us go to 11, then 12 million visitors so that we can't even move about as residents. We still love the state for our own children and for our own families.
There are a number of comments in here asking about the sort of reopening and wondering why we can't wait until at least kids are able to get vaccinated. When do you think that those under 12, what have you heard on the national level in terms of when kids will have access to vaccines? And why not wait to do the kind of reopening that you're talking about until at least we can reach that benchmark, if not the 70%?
Well, it'll probably be September when kids can start being vaccinated. Keep in mind that children are not having very significant disease, and so they're not particularly vulnerable. Another thing to keep in mind is our schools have already become very well vaccinated. Teachers and our administrators and everyone working at the schools, serving them, doing the hard work behind the scenes are vaccinated. So they're quite safe. Like, you can't wait forever. And what we're doing is we have a tourniquet essentially on our economy. And that tourniquet, every once in a while, we let out a little blood and some part of it survives. Forgive the physician, chatter, that's kind of deep in me. But that tourniquet is actually starving off the circulation to a lot of our smaller businesses. They're dying and they're barely staying alive. They need to survive economically because they employ the bulk of our people. Hotels are finally beginning to thrive again, and that is extraordinary. We have over 230,000 people that work in the hospitality industry. Had we waited much longer to allow travelers to come here and come here safely as they have, you could imagine what that impact would have been. I was very glad to kind of study up on those numbers with some of my advisors this weekend. But now we turn to the smaller businesses that can't make it if we don't begin to get real and get back to normal. Whether it's a shop that does birthday parties and they sell balloons, but people have not been able to gather and they've been almost bankrupt for a year now, to a small mom and pop restaurant that at 75% can't really function given the spread. We're not actually preventing any disease being spread now. If people are wearing masks, then we're safe. If they're vaccinated, we're utterly safe. So follow the science, basically, is what I'm saying. But if you wait for everyone to get vaccinated, you'll be waiting a long time, because I have a strange feeling that moms and dads are going to be somewhat hesitant about getting their 5-year-old to 11-year-olds vaccinated. It's not the kind of thing that parents do lightly. They'll get vaccinated, but they may not have their children fully vaccinated. So I don't want to wait all the way till 2022. That's just not on the table.
So would you be in favor of lifting the restrictions that are currently in place on restaurants right now? We do know that they have that 75% capacity, but still also have that 6 feet of distance, which is creating a difficulty for a lot of those businesses in the restaurant and hospitality industry. Would you be in favor of lifting any of those types of restrictions that are currently in place for restaurant establishments before we get to, say, that 70% or altered and edited benchmark?
Absolutely. Especially if people are vaccinated. If people are vaccinated, there should be no restrictions whatsoever. And I think we also have to trust people at their word. If people are unvaccinated and going anywhere, they know that they're putting themselves at risk. But everyone else who's vaccinated is safe. So I'm fine with it. I also think that it's been somewhat overkill. We're probably the last state to have such restrictions.
Is that something that's being discussed right now? We had Libby Char on here and along with Dr. Kemble on Friday. And, Dr. Char just said from a, public health standpoint, she liked the 6 feet. So what are those conversations like right now?
Well, Dr. Char, who I have a lot of respect for, Libby, is a public health official, and they look at everything through that singular lens. There are multiple lenses in society. This is a very complex telescope when you look at all of the lenses that are necessary to see exactly into the heart of our economy and the heart of survival for our people. If we are safe enough with low counts as we've had, if we are safe enough with low hospitalization rates, then it is time to open up. And that's just reality. So the pressure will mount. The governor will ultimately have to make a decision. But that's why I think we're going to quickly get to 65%, thank goodness. That, combined with the immunity that's already in our society, as I mentioned earlier, should be sufficient. These are tough decisions that they have to make, but I'm not going to shy away from sharing my opinion. I think that we are safe as a society now because people have been so responsible. But if I can, it makes it a lot easier for me to make this case with Libby, with Governor Ige and others, if more and more people are vaccinated. So you can do us a big service when we're talking about this argument by getting your buddies to go get vaccinated sooner rather than later.
We know that you mentioned the emergency proclamation, and that essentially could be coming to an end in August. But we also know that wrapped up in that emergency proclamation are things like the eviction moratorium and other things and other supports that are helping to support people during this time. Are you not concerned when those type of restrictions on evictions, when the federal government stops providing that added $300 support in September? Are you at all concerned about the wave that could potentially come and hit those who are benefiting a lot from the services that the federal and state government are providing?
Of course I am, but here's my thinking on the matter. People have to go back to work. We have difficulty right now with some of our businesses and their functions because we've not been able to get the workforce fully back because of some of those benefits. Now, the benefits were necessary. They were important and they were appropriate to keep people alive. Now it's safe to go back to work. So I'm encouraging everyone to go back to work. It's a positive thing to be working. It's positive self-esteem. It's good for your family. Also, let me give a special plug to Mayor Blangiardi. For those who are in poverty or living between 30% and 80% of AMI, which is the average medium income, he's been pushing out over $1 million a week in rental support. He has about $180 million to provide of support. And I got to really give super chops to the new administration. They are kicking butt on programs like this. And that is going to support people as we pull back from some of that federal money. Previous administration was only able to get a very small amount of money out. And this administration is getting a ton of money out into people's pockets, getting them housed, making sure they're stable. And now I know it's apples and oranges, but man, Blangiardi's doing a good job on this issue in particular. And I think that's what we need. We kind of use these cliches of all rowing the canoe in the same direction, so on. What's happening? So what I would say to people is go out, pick a job, get back into the workforce. We need you. We need you to help us because those federal dollars are going to go away. But know that there is some support that will still be there. And if you have needs, you reach out to me or Mayor Blangiardi or the other mayors. We will find a way to be as supportive as we can be.
We only have a few minutes left, but at the top of the broadcast, you did mention that 7 people were hospitalized just yesterday. I wonder if you could tell us a little bit more about the profile of who is getting the disease right now and where they're getting it.
And that was at one hospital alone. Now we have 40 or 41 people in the hospital, depending on discharges right at this moment. It's been hovering in the mid 30s to low 40s, but 7 individuals went anew into one of our best hospitals, Queens Hospital yesterday, 2 right into the intensive care unit. These are individuals who are middle-aged, but right into the ICU because they were not vaccinated. Individuals who are vaccinated under rare circumstances can still catch the virus, but they do not have severe illness. They don't end up in the hospital almost ever. I would say 95% of those people who have been hospitalized have been unvaccinated. So it's still happening, and it's going to happen in clusters, whether it's an outbreak at a prison, although that seems to finally have been put down, or in some of our communities that just do not get vaccinated. There's definitely some health disparities between some of our communities. Some of our people, for instance, our Hawaiian community has had a slightly lower rate of being vaccinated because probably they've had less access to healthcare. And, I worry because I don't think it's fair to individuals to be denied that access, but it's a reality and they end up in the hospital. So I want to see these hospitalizations drop down to, the teens or even single digits. That will be the sign that essentially COVID is over, but it's just not quite over yet. And so as you've posed these questions, you can see there's a balance, right? We need to get back to normal. We need to get back to open. We want to get everyone vaccinated, but some people are refusing and they will be the ones that end up in the hospital. So this is the yin and yang of COVID right now. But suffice it to say, we're in a much better place than we were last 4th of July, because after last 4th of July weekend, we saw an enormous surge. With no immunity, we went suddenly up into the 300s. We saw 300 plus people in our hospitals. And I don't get nervous about many things, but that brief period of time made me very worried about our state and whether we could survive this COVID crisis.
We only have a few more moments here. Just wanted to provide you one final thought or final word or message this morning for those who are tuning in.
Just a great deal of respect for those who have fought through this COVID crisis. But please, the last 250,000 adults who can get vaccinated should strongly consider it. And when the time comes for our keiki under age 12, parents, please have your minds made up. Talk to your pediatrician, soul search with your families about how you're going to go about it. Because if you're going to have your children vaccinated, do it on the sooner rather than later side. It will benefit all. I only care that we stay healthy and we return to normal for our society, because there's really special times ahead now that we've come together through this crisis.
Lieutenant Governor Josh Green joining us from the state capitol on this holiday. We do appreciate your time this morning. Thank you so much.
Thank you, guys.
Thank you.
Interesting to hear him there, Ryan. And also, you know, he talked about that sort of balance between the economic needs of the state and the public health needs. We see a lot of you in the comments sort of having this same fight, and it really reflects the conversations that are happening basically throughout the state right now.
Yeah, and talking about how the state and its leaders are going to have to find this balance between tourism and, you know, the cries of the public and what many are saying is called over tourism. We'll be actually speaking to two leaders who are going to be helping likely in this process and in this debate. That is Senate President Ron Kochi and the House Speaker Scott Saiki, who will be joining us here on this platform on Wednesday to dive a little more into that conversation of how they can manage tourism moving forward.
Right. We know that the legislature is in conflict with the governor over a number of bills that he says that he intends to veto. So we'll be talking about that, the daylight that exists between those two camps. And also you heard there Lieutenant Governor Josh Green talking about who is getting the disease right now. Again and again, we hear it is the folks who are not vaccinated. And he talked about the holdouts and not really wanting to force people to get vaccinated, but also feeling like there is a smaller and smaller number of individuals now who are essentially holding the state back from, you know, the possibilities that he talked about when it comes to reopening. So he's talking about looking at other metrics, perhaps hospitalizations, and maybe lowering that benchmark to 65%, because he's also counting the people in our population who have already gotten COVID. But, you know, we had Libby Char on here on Friday, and she's certainly not in a hurry to lift any restrictions anytime soon.
Yeah, and you know, you heard the projections from the Lieutenant Governor saying it could take up to 3 months to get to that 70%. So we'll be looking to see if any of those adjustments are made to the governor's benchmark of that 70% and how they may be able to compromise on some of those areas given those other benchmarks that the Lieutenant Governor also suggested. So a great conversation this morning with the Lieutenant Governor. We thank all of you for entering your comments. We know that there are a lot of comments in there, and we try to summarize some of your questions as best as we can, because we know that there's always so much to get through with the Lieutenant Governor, but we appreciate him taking time on this holiday to join us. And we thank you for also taking time to be a part of this conversation today. We'll see you right back here on Wednesday. Aloha.
Aloha.